Greetings and good evening. Thank you so much for joining this broadcast. Welcome. And as always, would you be kind enough to let me know whether you can see and you can hear clearly so that I can know the technical quality before we proceed. It is always a pleasure. It is always a joy to speak to you and to share with you that which I consider to be important matters regarding the situation here in Guyana. Welcome, welcome, welcome. Thank you so much for being here. Please let me know how we are in reference to audio and video. It's loud and it's clear. Great. Loud may not be good, but I understand. Right. All right. Now, once the audio and the video are fine, would you please be kind enough to share the broadcast or invite someone to the broadcast so that they can be made aware about this, what I consider to be important development and hopeful development in relation to the stand I would have taken and where Guyanese are, or in reference to those who have an interest, where we are in this, what we deem to be a fight for the recognition, the value, the respect, the regard for our views as people in relation to the order that was issued by the Minister of Health in July, which took effect on the 1st of August, and there has not yet been, to my knowledge, at least I haven't seen another order issued. One should be issued to guide us through September, because it's normally done on a monthly basis. Thank you for joining. I appreciate your being here. I am not the kind of person who waits for numbers to increase before I speak to people. I do not see the need for that. There's a rebroadcast, you can capture it. Those of you who would be here on YouTube as well, or in the YouTube upload. My channel is Nigel London TV. You can join there as well. You can view actually a rebroadcast. Good. I had a meeting today, and it was born out of the position that I have taken and the obvious response that is being had based on that position. Some of you would see this or report of the meeting on the Department of Public Information's platform, since it is a government agency. But I believe that it's my responsibility to speak to you in a more holistic manner based on, or to report about that meeting. Let us be fair. In meeting with a government official, I am cautious as to what I should share and should not share, but I'm also aware of the importance of speaking to you from a platform that I control, instead of one that has editors, managers, government officials who would want to be seen in a particular light. I am grateful, first of all, for the fact that Guyana can have a situation in which a minister of the government can have a conversation with an individual, knowing that we may not agree on everything, but at least we have the right to have a conversation. And I've said that on numerous occasions, that Guyana has to find itself in a position whereby people learn how to speak across the floor, speak to their enemies if possible, and still be mature enough to move forward. It is unhealthy for any nation, and you're seeing this in the two major political parties. It is unhealthy for any nation, any people, to be led by those who cannot have a conversation, even if they disagree, and one that is founded on certain principles. We had in Region 10 a March of Unity the other day, and before that they were public displays of disagreement with what the government was doing, or the order, I should say, that Frank Anthony, the Minister of Health, would have issued. And some of it, somebody said they're having a hissing sound. So, maybe we can lower it. So it was observed that we have some issues to deal with, because Region 10, as I said, it's known, is not one of the regions that has a high rate of vaccination or who have taken the injection. I still do not consider them to be vaccines. What the issue here is, or to present to you, is this. There are two platforms, at least two, on which we met today. One platform is that this minister represents the government. He is a politician. He therefore would speak, or is expected to speak, as he said. He's expected to speak from a political perspective. I did say to you, and I will continue to say to you, as I would have said to the minister, for as long as someone speaks on a political platform or from a political perspective, we have a challenge, because this issue is science oriented. It's a matter of science, where there's an infectious disease. Persons are some people are getting ill, people are recovering on a very, 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 an extremely high scale. But if we look at it from a political perspective, then the politicians have responsibility to appear a certain way. That's how they view themselves. But if we view this from a scientific perspective, which is what I've done from the beginning, then we have a collision. And this happens across the world. The minister and I had a conversation, and let me begin here. Because someone saw from their side, and I saw the need as well, for us to begin to talk. Taking to the street all of the time, which is necessary, is not the only way to address issues. We must be willing at some point to sit at a table and have conversations. I went to the meeting, and it is disheartening that I may have to issue this disclaimer, but I would. I went to the meeting not because I expect the PPP Civic to buy me over, to be considered. I expect to be considered one of theirs. I did not expect to be considered one who has an ambition to be involved in the party, because they know where I stand. That's not even mentioned up in AFC here, because they never had a conversation with me at any forum. So I commend the minister for taking the time to travel to Linden for us to have a conversation, because it's that important. And for us to understand where I stand and where he does in reference to the government's position. And for the government to understand where I stand when I take a stance. I said, I stand for you. What is meant by that? So the meeting for me is important, because My position is not to destabilize governance in Guyana, as others may have their political agenda. My position is not to destabilize. My position is for us to have what is right done by my people. Do what is right for the Guyanese. Do what is fair for the Guyanese people. And more than anything else, hear the concern of Guyanese people, more so in Region 10. The minister would have had in his company media personnel from the Department of Public Information, and I'm fine with that. I'm not the kind of person who say I don't want to meet with these people. I want them to hear what I have to say, because it's not a secret. Whatever I had to say today, I said publicly before. In that meeting, we agreed, and if you do not have the ability to listen and pay attention, this may not help you this evening. In that meeting, we agreed, and that's important. We agreed to certain things when he began to speak to me. The first agreement established that I'm not a conspiracy theorist, though every theory is not a conspiracy. But I am not a 5G person, because when this began, I told you all, do not listen to these crazy people who talk about towers and towers, because GT&TV has no tower in this country. But yet Guyanese were talking about 5G tower. And if you speak in a certain way, then people of a certain status and stature will not listen to you. And that goes for some of you preachers. This was not a meeting about the mark of the beast. This was a meeting about people and what my people are faced with, and how can we address a matter whereby Guyana can move forward. Most are represented Region 10 in my interest, not representing them as a political leader, but as a person who lives in this region, who is concerned about what is happening in my region, and by extension, the country. So the agreement was that COVID-19 or COVID does exist. I agreed to that because it does exist. I was one of the first who said with patient zero that you should not have children in school, even if it's just one case, because it's an infectious disease, it's novel, it's new, nobody in the world has dealt with it before, so we don't know what it's going to do. That was since AFC's time. I also agreed when the minister asked about whether people are dying. Yes. Persons have died and are dying as a result of the infection. That's what people are saying. Fine. I can agree to that. Thirdly, we agreed that persons should be tested. This is where many persons have had an issue. And I hope you won't have an issue tonight, because I've never once said that people should not be tested. I have said across the board, firstly, if people who are vaccinated can be infected, which is why they wear masks still, then everybody should be tested. If our interest is in public health, then we have to abide by protocols and principles that govern public health. If anyone can be infected with an infectious disease, then anyone who can be infected must be tested regularly, if our focus is on public health. But I agreed with the minister that yes, people should be tested. I'll speak to that, Rosanna, because who the minister is isn't always that critical, but I'll mention it in a minute. I have no issue with people being tested, as long as it subscribes to a scientific protocol. So we agreed to that. We agreed that there is the existence of a virus called COVID, SARS-CoV-2. We agreed that people should know their status. We agreed in terms of testing. We agreed that individuals are dying as a result of it. We agreed that there should be a response to it. That's in the best interest of a society. Oh, but here is where we had cause to have a conversation that is very, very, very potent, and you need to hear it. The minister who came to Region 10, you'll see it in the Department of Public Information and everything else, and local news. He came for two purposes. One would have been to distribute the farmers, the flood victims grant, and two, to have a conversation with me. Both events would be reported on the Department of Public Information and NCN, I would assume. So Hugh Todd, the Minister of Foreign Affairs, came to Linden. He represented the government and spoke from that platform. The engagement or the perception that was had is that I'm speaking from or standing on a platform of a spiritual leader. That had to be corrected because I was specific, and that is why I'm thankful to Yahweh for wisdom and how I function and for evidence on my platform. I was specific in noting from the beginning of this, from the very first day that I saw the Mackenzie at the Linden Market, I said I am not standing here as any apostle or a preacher. I'm standing as an individual who's an independent thinker, and I'm standing because I'm a concerned citizen. This is not a preacher's platform. I stood as a resident of a region, as a citizen of a nation who has an issue. So the angle cannot be in any circle that this is a preacher man who came to speak, and a preacher takes a stance, and a preacher is doing this. That is not the angle. The second thing is, or the perception could be that, okay, I'm standing as a social activist, and my position is to advocate on behalf of society. But that too was an issue, or could be a problem in terms of how it's viewed. Because if I stand as a social activist, it doesn't mean that I have to stand on the platform of science. There are many social activists who are speaking around Guyana now, and they're just rattling things as though they have a right to just argue or join a fray or join a group who's opposed to something. But they do not have the most efficient and necessary platform on which to stand. And that is on the scientific principle. So I made it clear to the minister that my position is scientifically oriented, not religious, not social activism. What is the science behind this situation? Because my position is that if we focus on the science of the situation, then we have a right to examine the response that the government is taking, the response that the Minister of Health has taken, and what is the science, which is not politically bound. Politics doesn't govern science. So what is it? Where do we stand on a scientific perspective or platform? Where is it? And that is where my conversation with the minister would have headed. I made it clear to him in our conversation. I agree that COVID exists. It's a new virus, novel. It's affecting people in a particular way, and people have died. But here's the other thing. When it was my position, or my platform was this, or my position is this, let's deal with how many people have died in reference to how many have recovered. On a global scale, I said that if the world in 2019 had 7.7 billion people, it has more today. And of that number, in a 16-month or 17-month period, 4.5 million people have died from this disease they call SARS-CoV-2. Well, we have had in just 1 year, 9.5 million people in 2020 died of cancer. So I ask the question, if we speak into public health, which one should be more alarming? Should we focus on a 17-month period in which 4.5 million people died across the whole world, which is just 1.7% or so of the population? 98% of the population has survived. But in a 12-month period, we have 10 million people on average dying of cancer. So I said, which one should be more alarming? If our focus is on healthcare and our focus is on the fact that people are dying, then which area should we be given great attention to, and which area should we be alarmed about? When you have more than 50%. So it's obvious that if our focus is going to be on healthcare, we have another crisis on our hand that supersedes COVID. It is 100% or more deadly than COVID, and that's cancer. What are we doing about that? Where's the financial input into research, into healthcare, into persons leading a particular lifestyle that doesn't lend itself to them dying of these diseases? But I understand that cancer is not contagious. It's not infectious. SARS-CoV-2 is infectious. So people do not wish to have an infectious disease proliferate through a population. But my position is that we are not prepared to focus on the political aspect of a situation and deny the science which should guide the politics. Politics do not guide science. Science guides everything else if it's a scientific a situation whereby science is involved, which is the case here. Medical science more so. The other point that I raised to the minister is that I do agree that people should be tested. Absolutely, they should be tested. Beyond the shadow of a doubt, if it's an infectious disease, they should be tested. However, here's the problem. Who should pay for the testing? Who should bear the financial burden to be tested, of being tested? So I say again, I have no issue. I have never had an issue with persons being tested. I agree that healthcare workers, because they interface so much with people on a general daily basis, they should be tested. But the question to the minister became, who? The issue we have, or I have, is with who is being told to finance or fund the burden of testing. Who? In this Guyana situation, the policy is that the employee and the public, whoever wants to enter a public building, they must bear the burden of being tested with a PCR test. And I shared with the minister that if from a political perspective we say that PCR tests or people should be tested, it sounds right. But if we say, or if we dig deeper beyond a political statement, we have a problem. Because if we agree that people should be tested, but we cannot agree on the method of testing, and who should finance that method, then we have a challenge. Because if persons are being told that vaccines are not mandatory, which is what the government and the minister has sought to say, that vaccines are not mandatory. If they're not mandatory, then my question is, who then, on a normal basis in Guyana, can afford $25,000 or so every 3 days or every week? Who can afford $100,000, depending on who's requesting it, every month as an employee in this country? Who in the public service? Some Guyanese are unemployed people. And if they're unemployed, which unemployed Guyanese can afford $25,000 every week if they have a situation to deal with at a government office, which is a public building? From Region 10 perspective, I made it known that Region 10 is an economically depressed society, region. Whatever the reason, the reality is that Region 10 is lacking in investment, is lacking in financial strength and economic strength. And so, if we have a case in our nation in which people are being asked to finance, to pay for a PCR test, when the government should be most informed about the economic state and the economic state of every citizen in this country, just about an average. We know what a GDP is. We know people's earning power. Then why? The government is equipped with the salary scale of all public servants, and in some cases private sector employees. So they are well aware as to how much public servants earn. They know how much nurses earn on the scale. They know how much doctors earn. So why is it? They know how much a janitor would earn, a janitress can earn. They know those who work in the schools, they know how much these people earn. They know what are called entry-level employees. You know these things. So how then can we have a situation in which the government, who is furnished with this information, is acting as if Guyanese can afford to pay $25,000 every week as an option? So I said that it can be said that the vaccines are not mandatory as they label vaccines, but the action or the consequence, and I'll speak to that in a minute, that the minister spoke to and Ramsamy spoke to, point towards mandatory vaccination. So what are we seeking to do to our people? I made it clear that if the Guyanese public, Region 10 included, if we're told that not only should you have a PCR test done, but you must go to a private entity or a number of private entities, not even a public. You cannot go to the public hospital. You cannot go to a public healthcare facility. You must go to a private entity, privately owned, privately operated, and pay them $25,000 before you can access a public building. That in itself would not lend to a healthy environment in the nation. Because persons have a right to question why a government would want to send citizens to a private entity or a number of private entities to be tested, to return to a government or public building, when we have hospitals across the country, when we have clinics across the country. So if we want to present a case a position from a government perspective, if I said if you would like to present a situation in which your thoughts are towards the well-being of Guyanese, then we have to sell the behavior, demonstrate that behavior, exhibit that behavior, so Guyanese can have confidence in what is being done. I also spoke to the minister from the scientific platform that how could you have a case in which on a global scale or on a national scale, well, we call it a pandemic, so you have to look at it across the world. 98% of the world's population has not died. 70%, 10%, 50%. If 50% of the world population died, then there's a serious crisis. 20%, 10%, 5%, 3%, not even 2% of the world's population has perished because of this virus. So where is the global alarm? When I said for more than or just about a year there were no vaccines, almost 1 year into it, up to about 6 months into it, there weren't any vaccines. So if there weren't any vaccines, how did so many millions of people, billions of people survive without vaccines? And how then can anyone suggest that vaccines is the way out when there was a way before the way out? More than that, how can we suggest that vaccine by definition, which is considered the original intent, what was the word meant to mean? It was supposed to mean something that prevents being infected by a disease. How then this is the first time in human history where vaccines do not prevent infection? But it's being pushed as a solution to the problem. What I'm grateful for is that the minister admitted that, and I respect that. He's not a scientist by nature, he's a political scientist. And so he said what I was asking for all along. It may be better or good to speak to the likes of Frank Anthony and those. Have I not said it repeatedly on many broadcasts with you all? That I have no issue. I am pleading with the government to let Frank Anthony, and I said that today as well, let the Minister of Health and any team he wants to assemble, let the COVID task force and the Minister of Health sit and embarrass me publicly if they want to do so. Silence me to say, listen, these things you're saying are untrue, and Guyanese, you need to hear it from our perspective. This is the truth. Let me share this with you all. If ever you have a situation in which a government or any entity does not wish to engage, and I said this to the minister as well, if you do not wish to engage in debate, in exchange of information, you are unprepared to be trusted. If Frank Anthony is the Minister of Health and the doctors surrounding him like Carpenter and these people, then let them speak to the nation with me. I don't need a team, but I can have many people come with me as well. But I'm saying I don't have to have a team to deal with this matter. But if they permit me, I shall invite certain people. Let us have a public debate to bring the facts to the table. And I'm man enough to say, if you're correct, you are correct. I've been asking for this for weeks, for months probably. Let us sit before the nation, because since I'm considered to be an influential person, that's why I've been labeled. I'm considered somebody who's a community leader. All these labels are coming out the woodwork. Whatever you want to label me as. At the end of the day, if you believe that people listen to me, then sit me in a forum where you and your entire team can silence me. It makes life easier for you as a government because you've been able to silence somebody you think is an opponent to what you're doing. It hasn't been done. I hope it can be done. Because my position is, let us speak to what the science says. I made it clear to the minister that I am not against vaccination, because I said it from the beginning, from the very first day. I said I am not against vaccination. I will never be against vaccination. Why? Because people have right to decide what they want. I'm not against people being vaccinated. That's your right. What I am against, I made clear, is first of all, persons being denied the right to have certain services without being vaccinated or without having to pay out of their meager earnings, if any at all, $25,000 whenever they have need after 72 hours to do business. It is crippling. It is destructive to the average Guyanese family. And it is unjust economically, given what the government knows. The other areas of discussion would have been looking at Region 10. Region 10 has got the lowest vaccination rate. That's now news. And it's no news actually. Region 10 is way behind, 23% first dose, about 10% or so second dose. And I reminded the parties that this is not, you're not fully vaccinated in some cases because you have to have a third dose if you're immunocompromised. Guyana isn't screened to see who's immunocompromised. You say take 2 doses and you're fully vaccinated, which is not the truth. Some people with a weak immune system need another dose. My position is that, okay, if Linden, if Region 10 is so far behind, then I said, maybe we should be considered a model region then. Because in this region, we do not have a daily average of death at 2% or 3% of our local population. So in the region where we have got the lowest rate of vaccination, I made it clear that I work with statistics. Because if the minister said that they come with numbers, as you may hear on the Department of Public Information report, if we're working with numbers, let's work with numbers across the board. And we agree to that. Do not bring numbers for vaccination rate, but deny numbers for infection rate. So let's work with numbers across the board. Region 10 does not have a case in which there is an alarming or an influx at the Wisma Hospital, which is called the COVID center here for us in Linden. We do not have 50 patients in the hospital tonight. We don't have 25 patients in the hospital tonight in Linden. We don't even have 15. So if we are so low in vaccination rate, and then of course I listened to Frank Anthony the other day and he said, well, you know what? People aren't being tested. So minister said the same thing. Of course, from the government's perspective, the Region 10 people aren't being tested. So that's why the rate is so low. Well, the fact they're not being tested may be because they are healthy at home, or they have no reason to go to the hospital. Because I don't know of anybody in this region who would see a relative being unable to breathe and just leave them to die in the house. So the fact the persons aren't showing up at the Wisma Center or the Linden Hospital complex, and they're not being rushed to Georgetown because they can't breathe. Region 10, even if we have high cases of SARS-CoV-2, we are not reacting in a manner that requires hospitalization. So isn't that still good for the government? My question is, what do we want to achieve? Do we want to achieve herd immunity, or we want to achieve vaccination quotas? I made it clear from my platform, my perspective, that I posit to you that Region 10 may be a model region for Guyana, because we don't have a overflowing of the hospital here. Neither do we have a high morbidity rate in the region. Our infection rate today, in terms of positive tests, was 0. Yesterday may have been 1 or 2 or 3. The day before was 1 or 0. So where's the spike for Region 10? And this has been ongoing for just about a month. My position today was based entirely on science. Because politicians have to work as politicians. Those of us who've been trained to teach science and trained to function like doctors and nurses in the science field, our position doesn't have to be political. It is entirely scientific, which is healthy. But again, I'm saying to you that the fact that Minister Todd could have sat and engaged in a conversation of this nature was healthy. And it is healthy for moving forward. Because we both agreed, again I say, we agreed that there is a disease that has to be dealt with. We agreed that people should know their status because it's an infectious disease. I shouldn't be saying, even with the flu, when somebody contracts a regular common flu or the seasonal flu, you go to the doctor diagnoses it, and you're told to go home and isolate yourself so you won't infect your family. That is normal for infectious diseases. That's normal. If you have a case in which there is an infectious disease in the community, then we should be tested to know what is our status regarding this infectious disease. If we want to have a normal life and walk about the place doing normal things, we should know what the status is. But I'm saying again that it has to be done in a fair manner, in a manner that does not put burden on the individuals who being mandated or required to present tests in order to access their place of employment. It is unjust. But if we do not have a case in which the focus is on science, then the focus becomes political. If the focus is on politics, then politicians will say that they have to protect the people, and they protect them based on their policies. Note, not necessarily science. Let's work with the science. Region 10, I say again, must be a model region because the science is on our side. The science of immunity is on our side. The science of herd immunity is definitely pointing to our side. The science of surviving a disease without having to be vaccinated across the population is also on our side. If the interest is in science, let it be in science. If the interest is in politics, then you will never be able to function well with science. So here's the other point, which I raised publicly. I suggested that if the government has such great interest in public health and in the well-being of all Guyanese, then here's what I'm asking of the government. Please inform me, and I'm free to tell the people, about the government's position in relation to adverse reactions to vaccination. Because In the US alone, there are thousands of people who have died as a result of what are called vaccine-related deaths. And this is where I would like Frank Anthony, and I've been asking him forever, and his agents to speak to it. Vaccine-related deaths. The World Health Organization, the Federal Drug Administration, the Food and Drug Administration of the USA, they have spoken to something that's very critical that this government apparently hasn't heard of yet, which is that every person who is vaccinated and they die, you have to record it. This is written all across the FDA's platform. This is necessary because it's what is called a vaccine-related death. If a person goes and gets vaccinated and they die 2 or 3 days after, or they feel sick, they were normal, they're now bedridden, and after taking a vaccine, they haven't been walking for days, the pressure increased, their blood sugar spiked, their heart rate spiked, they got fever, chills, wherever else it is, they died. It is, again, required that every government takes note of and reports that there has been a vaccine-related death. What you're getting here are questions like, okay, so how do we know the person died of a vaccine? The FDA never said that. They said as long as the person receives a vaccine or anything from the vial called a vaccine and they die, because remember, you're supposed to track these people. You're supposed to have information from these people on a long-term and a short-term basis. The FDA has required Pfizer, for example, to have information on a short-term basis and a long-term basis. So Pfizer has to continue with research to prove over years the efficacy or the effectiveness of the vaccine and the safety of the vaccine over a long period of time. How can Guyana position itself to say that we haven't done, we do not do post-mortem to prove the person died of vaccine? That is not the case. The case is whether a person died after taking the vaccine. If the person is on record of having taken the vaccine, they were alive to take it. If 2, 3, 4 days, a week later, 1 month later, the person is dead, you're supposed to record that the person has died from a vaccine-related death. Later on, they will decipher which one is related to the vaccine indeed or not. That is not being done here. What does the minister speak to exactly? Comorbidity, underlying issues. Whatever the issue is, the person took a vaccine and they're no longer here with us. So I ask the question. If any individual in this country were to suffer an adverse reaction or the person dies, is the government prepared to and committed to and bound to provide financially for the person's family or the individual if they fall ill? The question, in all honesty, was never answered. And this is not to bash a government. It's to highlight something to you, that the government at this time is unprepared to do so. Are you with me? Because I asked the question of a minister who represents the government. Because I intend to go to the people, as I do tonight, to share the truth with the people. So if I am sitting with a minister representing the government, and I ask a question based on my platform, from my perspective, based on where I am standing, what is it that we're going to do? If someone takes a vaccine, takes a shot, and they suffer an adverse reaction, or they die, where is the insurance from the government to say, we encouraged it, we advanced the vaccine program, we said there's a policy that everybody should be vaccinated and all the rest of it, and now people are dying, We are going to therefore take responsibility. What is being suggested is that there is no proof that the person would have died from a vaccine, which is unfortunate. I therefore made it clear that that is why we'll have aversion. Persons will not be inclined to go forward to say, come on, give me a shot, if we don't have these things addressed. Which is why I said, let us sit on a public platform and let us have a conversation. I suggested to the minister as well that the reason Region 10 and others have a problem is because the minister responsible for health has opted to not engage a particular strata or class of society in this conversation. He puts doctors on the television or the Ministry of Health, whoever does it, and doctors just say they're debunking myths about COVID. Radio personalities, TV personalities, and this is the most disgusting aspect that I'll address tonight. We have got TV personalities, radio personalities being paid to speak to such a sensitive issue. Guyanese, go and get vaccinated. It saves life. Who are you? What is your degree in? When did a radio personality or TV personality become a medical agent or a science-trained person, as I, Mr. Thomas, and others may be, and are? When did you study in our field? To determine how to treat with pandemics and how to treat with diseases in a community or epidemics and so on. When did paying you for a 30-second clip or spot or 15-second spot? How does that work? The government, I requested of the minister, let them bring a group of people, sit together. We don't have to be in agreement. As the minister and I were not in agreement on many things. But let us sit together and have an exchange that the population can see and make determinations based on what they hear. But they don't want that, apparently. Because if they wanted it, they would have done already. I hope that after the discussion it can be had. We need to have a mature society where persons are able to hear and move forward. But if on a political circle, when elections come, even the politicians can't sit and have a debate for the nation to hear them speak, what do you expect to happen? We don't have a culture in our nation that lends itself to people disagreeing in a sensible manner and putting information on the table. Let us have this on the table. Let us have a forum in which we can have discussions, debates. One side present their facts, the other side present their facts, and the population is able to listen and gain information from it. We can agree that we're not allowed to present conspiracy theories because I do not subscribe to conspiracy nonsense. Let us present the hardcore scientific facts from both sides. The society can only benefit if they hear not an agenda, but they hear information. We would not move forward in this situation. We wouldn't move forward if all that's on the table from the government perspective is be vaccinated to get a particular number of vaccines, vaccinated individuals. You cannot move forward like that. Because in our society, there are people who do not wish to be. So here's the other point. We have a case in which our Minister of Health has suggested that initially, listen to the language, every adult, every person 18 years and older should be vaccinated. That was the initial cry for weeks. Every person, I heard it repeatedly on the radio, every person who is 18 years and older should be vaccinated. When you have got that statement made from the minister, I said, how do you make such a blanket statement when there's so many people in this nation who are walking around without any COVID symptom, but they're positive? Y'all need to pay attention to this, because I said it repeatedly. In early August, I said, be careful here, because the CDC issued a statement that said, the Center for Disease Control, because Guyana is not independent in terms of how it deals with information. Guyana is Ramsamy said it. Leslie Ramsamy said that they look at Japan, they look at France, they look at cases in all these different places, and they're picking out information to give to Guyanese people. I said that the Center for Disease Control in the USA would have made it clear that if you ever have had a bout with COVID-19 and you tested positive, do not take a vaccine in the USA for 90 days. That's what they said initially. 60 to 90 days. Do not even go close to vaccines. While the US was saying that, Guyana was saying to people in the Ministry of Health, take the vaccine. 18 and over, take the vaccine. They weren't even testing you before you go to take it. Can you recognize what I said since early in August? What trouble you're playing with, and why it is possible for there to be so many reports about persons suffering severely and even dying in this nation? Because what the CDC, the Center for Disease Control in the USA, said was not being done here. It was not being done in Guyana. So if the experts that the Guyana government would rely on Ministry of Health and so on for information are telling you, do not inject people with any of these vaccines if they're COVID positive, or if they had it over at least for 2 weeks or anything, don't do it. Initially they said 90 days, don't do it. Do not do it to them. This government was busy injecting people. What do you think, what are we dealing with here? Can we not, from the scientific perspective, see a problem? It is a serious issue that we're dealing with. I saw later on the chief medical officer, in the second week of August, I think it was, then finally issued a statement. If you have had COVID over the past 2 weeks, you shouldn't be vaccinated. But some people, when that statement was made, they already had a vaccine in the system. Do you not see a problem that would require persons being cautious? Because if information about vaccination is ebbing and flowing, it is not stable, what must people do? But the reason why I'm comfortable with the discussion is because there was a discussion. Get the point? There was a discussion. It didn't just have meetings in the street. It didn't have conversations in the road. It now had a discussion at the ministerial level with a community person, a citizen who says, I need to have a conversation because I said I don't have a problem talking with anybody. I was told there should be a conversation. Yes, I don't have an issue having a conversation with anyone. Because I am not going to be coerced by a government to say certain things. Neither would I seek to impose anything on a government. What we can do is have a sensible discussion and let wisdom prevail. I therefore transition to the other point. I made recommendations because it's only fair that if a minister is going to report to his colleagues in the health field, because it took a record of what was said. As I said, there was a media team and others there. So if they took a report, if they're taking a report back to the decision makers, I sat not to bash, as they say, or to castigate a government. I sat to speak to, number one, what is the science behind my position? Secondly, how my people are being affected by the government's decision. And thirdly, how, based on my position, how can we move forward to meet at a point where Guyanese don't suffer anymore? These are my suggestions. And I lay them on the table for you. Because obviously after I heard that, I knew I wasn't expecting anything differently. The minister didn't answer, and I understand his position. He couldn't say that the government is prepared to pay anybody for any harm that they may experience because of the vaccine. That cannot be done. It wasn't said to me, which means at this moment it cannot be done. If the argument is that it's too much for taxpayers or for the government to pay $25,000 for PCR tests to be done, the government doesn't pay anything. The government spends money from the Treasury. The Treasury is fed by taxation and trade. No minister in the government puts their hand in their pocket or goes to the bank and withdraws money to pay for PCR tests for the population. So the population has a right, the people have a right to say what they require of the government because the people rule the country. The government manages our money. They manage our resources. And I would like to think that politicians in Guyana across the board need to get this message and live by the message. Politicians in this country govern our resources. They manage our resources. We are not children who ask daddy for pocket money and for spending money. We are adults, those who work. We are contributors to the economy. Even our children, when they go to spend money and they buy an item that has a value-added tax attached to it, my child would have contributed to the economy. The government does not own Guyana's money. They manage the finances of the nation. So no one can say to us that $25,000 per test is too much. That's our money. How could we... Okay, the argument for the Ministry of Finance will be, well, where can we get the money from? Because it has to come from somewhere. And the Treasury, how could we find $25,000 all the time to be testing people? And that's exactly my point. Because if the minister knows at finance level that the government, with all the taxes being collected on vehicle importation, we're in PAB, 3,000 something by now, or whatever series we gone up to, money is being collected all the time. The Demerara Harbor Bridge, millions of dollars every day. Berbice Bridge, money. Mackenzie Bridge, money. GRA, people have to license their vehicle, pay for insurance, pay for compliance. All that. Taxes of Guyana is a heavily taxed society if you do not know. So with all of this money flowing through the economy, I haven't heard anyone in politics say, on either side of the fence, reduce our salary by 75% and pay for people to be tested. Because we're the government, both sides in reference to opposition and sitting government. Yes, take our money. Because we love people. And we know the Guyanese can't afford in our constituencies. They cannot afford PCR testing. So take 75% of our salary and take care of the Guyanese people. That's when it will be where the government ministers and opposition ministers, members of parliament, they spent money. But if it's coming from the treasury, then the people have a right to hear from you in town hall meetings and stuff like that. How can we move forward? But if you make a decision that the taxpayers' money shouldn't be spent on the taxpayers for them to be tested, the taxpayer must find money from their pocket. The money in the treasury shouldn't be spent on us. We should spend money from our own resources to have access to buildings that our money, would maintain. I find that to be unjust, and I spoke to it. Here, therefore, would have been my recommendations. I posited to the minister that somebody asked a quick question. Hopefully I can see them respond. I wasn't going to take too many questions tonight. Let me see if I find it. Is it gone? Somebody please read Romeo hold this question if you can see it. So if the government can put measures in place to do the PCR test, won't it be the same taxpayers' money? They'll go back to the treasury, Romeo holder? Exactly. Thank you for the question. So, too late. Just give me a second. Let me get back to your comment. Okay, good. Here we are. Here are my recommendations. It is known, some of you may not know it, but it is known that there are somebody who wants to struggle with vultures. It is known that there are at least 3 tests for COVID-19. At least 3. I suggested to the minister, I recommended for consideration at the government level, the following. In the USA, because it's unjust for Leslie Ramsamy to only cite things that are favorable, or in his eyes, what the government should do to accomplish their objective and not look at the whole. It is unjust for us to consider the PCR test for every Guyanese, regardless of your economic state. Everybody does a PCR test if they're not vaccinated. That is unjust. When there are other tests that can be had that are not remotely close in terms of the expenditure. So I said, in the USA, this is established, this is known. In Florida, for example, people who are fully vaccinated, are tested to enter certain medical facilities with a rapid test. It's free. They don't pay $1 for it. They are fully vaccinated, even healthcare workers. In Florida, at certain entities, they get the PCR, the rapid test, they do the test, and they enter the facility. It didn't cost them anything. Because the intention is health care, not vaccine quotas. The focus is health care, not vaccine quotas. if the focus of this government is healthcare, then our focus would not be on private entities making millions of dollars on PCR testing. So I recommended that instead of having public servants and any Guyanese pay for a PCR test, if the focus is, and I agree, we must know our status. We must know whether we are positive or negative. If you want to access certain services, fine, no problem with that. If you want to deal with curbing a spread or whatever, fine, no problem. In New York, in New Jersey, and other places, you can pick up a rapid test just about anywhere, and it's free. In the UK, it's free. So let's get this clear here. If Leslie Ramsamy, an advisor to the minister, wants to cite and reference nations, we make reference to nations who are doing certain things, then let us deal with the testing part. But Leslie Ramsamy, I read what he said in the news, he referenced consequences that Macron said in France. He quoted the French leader saying that if you want to be irresponsible and you don't want to have a vaccine, then you must face the consequences. And I said to the minister that that should not be the language to Guyanese people. Because nobody is supposed to speak to Guyanese people in that manner. It should not be said that Guyanese should face consequences. If you face consequences, then the vaccines are mandatory. And why should Londoners and Region 10 people face economic consequences? Why should Guyanese face economic consequences when there is an easy way out? And the easier way is that it is known that UNESCO, for example, or UNICEF has partnered with the rapid testing manufacturers to produce rapid tests for $2.55 each, which is $500 just about. Okay, $600 if you want to call it that. Do you hear the difference, Guyanese? At this moment, UNICEF has made it, that's why the US has bought so many of it. The UK as well, and other nations. Because UNICEF said, people are being vaccinated, others may not be vaccinated, and even if they are vaccinated, they could still contract the virus. They could still be infected. So, hey, let us produce these rapid tests. Number one, it doesn't have to wait for 3 days to be sent to some lab and then you get the results later on. Number two, it is rapid. You get it within 15 to 30 minutes. So if I have a family member in hospital, for example, and I want to see the person has an emergency or anything like that, I can simply get a rapid test done, and in 15 minutes I can go see my relative in the hospital, as opposed to having to wait for 3 days if I can't take a vaccine. So I suggested to the government that we should not focus on PCR testing because you just want to have a quick result as to whether you are positive or not. Let's do the rapid test, because rapid test has an 80+% effective rate when persons have the virus, which is what you need to know. When persons are symptomatic, it is very, very high, the positive rates. So let's work with the effective rating. If you really want, if you do not want positive people to go around and walk around the place, I said that it's unhealthy. Therefore, let's work with what works. My recommendation is that if you want to go down the road of testing people, then have a rapid test done. Hopefully technology will improve itself, whereby you don't have to be shoving things up your nostrils. It cost $500 or $550, or I'll even stretch it to $600 for a test. My Guyanese brothers and sisters, how can you have $25,000 paid to a private clinic, private testing facility, when there's possibility for there to be $600 tests available to Guyanese? That is my initial suggestion, and that is one that we return to should be tabled at the government level. There's a stark difference between $25,000 and $500,000. If the government's focus is on determining your status before you enter public buildings, then it should never be a $25,000 cost. When there is on the market today, based on UNICEF's intervention, a $500 test, which should not be paid for by any Guyanese in the first place. Because this is not going to last forever. Now calculate how much money was injected into Gaisuko, for example, and how many rapid tests we could have with that money, if it's healthcare we're talking about, or some of that money. Think about how much money is injected into certain areas and how much we can have. If you want to know people's status, because no Guyanese should pay for any test. If you want to say, well, if you are employed and you want to contribute, or the private sector wants to contribute to this, then let the private sector contribute because they have enough money to contribute. KFC gave free chicken away yesterday. I think if it was free, think how much money could have given for rapid tests. How much is a small to cost? $3 something. If Guyana, according to the president, is going to be another Dubai, let's behave as if we're Dubai then. Let's begin to develop Dubai attitude, where we take care of people, because we can afford to do so if we go down the path of the rapid test. But if the government says that we are going to have PCR tests done for $25,000 at a private clinic, Guyanese are going to react it because it is unfair if there is on the market today a test that is for $500. The other thing I spoke to is that while the government is discussing, no pensioner in this country should be made to pay for anything regarding health care. No pensioner in this nation should be asked to pay for any PCR test or any test whatsoever, because pensioners have already made significant contributions to this nation, and today they call pensioners for a reason. They've contributed as they earned. And I recommended to the minister, I requested of the government that they should not have any pensioner in this country have to pay from now $1 to have access to their NIS or the old age pension. It should not happen. It is entirely unjust. It is wrong. Even if they have to have a nurse or whoever is dressed in full PPE gear to cater to pensioners, you should never have our pensioners have to subject to things, pushing their nose and all of that just to get their money. That is entirely unjust. I suggested that, and I'm grateful that the minister did not appear to have an issue with these suggestions, and that's I'm glad about, because his attitude was not about being offensive. It was about engaging in a conversation that can move us forward. The other point I raise is this. In some circles, it suggested that people can have, it was raised that you can have Zoom meetings, you can call video conference and whatever else it is, and you can have business taken care of. But I said that places like GRA, where people have to have their driver's license renewed, you cannot have a Zoom meeting to do a driver's license. So entities like GRA should have the necessary screens in certain areas where people can go and have their license renewed, have their matters dealt with. Some people have time-sensitive situations. Compliances are time-sensitive. So we should not have an entity like the GRA being made into one in which Guyanese cannot access services that are mandatory, that are legally required of us, unless you lax all the laws regarding driver's licensing and so on. Additionally, I mentioned places like the NIS. Because Guyanese pay NIS as long as you work in the public service or private sector, you're supposed to be NIS, supposed to be deducted from your salary. If NIS is deducted, if your contributions are deducted on a monthly basis or a weekly basis, then why is it that I cannot have access to my money? It's just like a banking system. The national insurance scheme is like a banking system. If I contribute to something, my money is going into it. How can you now say I don't have access to my money? That too was not met with any offensive demeanor by the minister. Because we must be fair to our people. We must be rational and fair to our people. If someone makes a contribution, then they are supposed to have access. So certain places should not be having this, passport offices and so on. It is unjust. And we're asking or requesting that our policymakers consider how this can affect people. I also share that if any government in Guyana is prepared to sit and watch this unfold, where so many citizens are functioning under duress, and label it positive because of numbers, then we are in trouble. Because I highlighted the fact that the numbers increased only when consequences were announced. The numbers increased when consequences were enforced. Persons could not get into work, so they ran to the vaccination sites to get vaccines. I do not expect any government to be okay with watching something like that, to say, well, the numbers are up in Region 4, numbers are up in Region 5, the numbers are up in Region 6. Under what condition, though? What generated this increase? It was a reaction to consequences. It was not a reaction to education. It was not a reaction towards people understanding that this is beneficial to me, hence I make an informed decision. It was not a reactionary persons who are saying, I am happy to be a part of a system in which we all work towards a common goal of vaccination quotas. It wasn't the case. It was the 1st of August, I stood there and saw it. Persons were locked out of, weren't allowed to enter government buildings, and they began to swarm Upper Brickdam vaccination site. Swarm it. So if we're going to speak to what has happened, we cannot just look at numbers. I spoke to the minister as well about the psychological impact this is having in Guyanese. If we look at numerical results without looking at what happens to their minds, then we are not paying attention to what's happening to our people. I am grateful that there was an opportunity to have a conversation that at the end, what was gathered, in reference to what the minister said, is, I am not against vaccination. I am not. Neither am I against people being tested. I'm against persons being told that they have to face consequences at their expense. And I therefore raised and posited certain suggestions that I would like to think are fair enough for the Guyanese public. It may be unfair to the private clinics, but my interest is not in promoting business for a private clinic. My interest is in what is good for my people. My final point, and probably among the most important points that I make tonight, is that this was not and will not be a political game. Because I didn't say this to the minister, but I'm saying this on this platform as I promised I would speak to yesterday. Ralph Ramkaran, a former PPP civic leader, suggested in an article, Conversation Tree, in his article, that whoever is saying my body, my choice has this political backing, which more or less is APNA FC they're talking about. And they're being pushed by the opposition, and it's an opposition game, which is why so many PPP supporters are saying that I'm representing PNC. First was APNA, now it's APNA FC, now it's PNC. Because persons who are sympathetic to this movement of the government, and who may still have political ties or political, in terms of mind, ties to the PPP civic, are suggesting that whoever is saying my body, my choice, and they're acting as if they are not in favor of this vaccination policy, it has to be a political move. On this platform, because I'm speaking to the Government Matters, I will speak to a member of ANOG and United Guyana because they form a part of the joint parties. So their turn is coming to be in Parliament. For Ralph Ramkaran to say that, it is irresponsible, and it includes me. And as I said to the minister, anything that the minister said, anything that any politician in Guyana says that affects me or my people, I shall speak to it. I have nothing to do with politics. I made it clear to the minister. I do not deal with APNA FC, I don't deal with PPP Civic, I deal with people. And I spoke to him as a minister responsible for a particular party, or in a particular party, and I will address him based on how I feel about the matter. There are no political sentiments attached to this. And for Ralph Ramkaran to, in his capacity, suggest that only people who have attached to a political party can have a position in this country, it is unfortunate, it is unfounded, and it's outrightly stupid. Is Guyana void of independent thinkers? Are we sheep led by PPP Civic, APNA FC, or y'all? Do we not have the right as a people to stand for what we believe in, regardless of what any politician says? When did this narrative arrive in this country, Ralph Ramkaran, that the only position any Guyanese can take when it opposes a government policy is that of another political party? Is that how weak your politics is? That's why you would not get anywhere. Because for you to suggest, to even remotely suggest that the only platform a Guyanese can take is APNA AFC or PPP Civic, you have something coming for you in reference to a reality check. Because I thought you formed a new United Guyana to not have us focus on APNA FC and PPP Civic alone anymore. It shall not be, for as long as I breathe, an environment in which you people believe that all Guyana has on the table are sheep who follow politicians, and I know some of y'all from ANOG like Akani Blair watch me, so I'm talking to you. Your party representative is irresponsible and his statement is unfounded. I don't represent APNA FC, and there's nobody in APNA FC who can guide my speech. Of all people, you choose them? No. We have in this country, and I said to the minister, because he was seeking honesty to figure out where do I sit? How is it that, how can I be seen by the government? I'm not focusing on as a spiritual person in this matter. I preach to the saints. I don't preach to people who don't know the scripture. I'm not here as a social activist. I'm not here as a politician. So it's difficult for them to figure out where do I fit in the scheme of their placing people in pockets in society. So in fairness to him, and he wants, okay, are you a politician in some way or anything like that? And here's my response to anyone who asks the question. If it includes standing for the right of my people, label me as what you want. Call me politician, call me anything you want. I will stand for my people. If it carries a label, put a label on it. So if you say that I'm standing for my people and that makes me politician, then put a politician attached to it. Put a politician tag on it then. That's fine, no problem. Because my focus is not on what I'm labeled to be, it's what I stand for. And I stand for the right of my fellow Guyanese to be respected and honored. If that makes me a politician, then so be it. I don't need one of your tags to function. But I made it clear to the minister that I am an independent thinker. I'm not a group person in terms of I have to have people to function. Because I never stood on the first day asking people to come and stand with me. I'm saying it all the time for a reason for you all to hear me. Because I knew this was coming. I stood as an independent man defending the cause of other Guyanese who are not able to stand for themselves, like the police, the army, my children, saints, the elderly, nurses, doctors, some of them who can't come and stand for themselves. I stood for you. Now here's Ralph from Quran seeking to inject me into a group because he cannot see beyond that group. And for those of you on this platform, I make it clear to you as well. Those in government who are watching on either side of the aisle, I make it clear for you all. If standing for my people makes me a politician, then label me a politician. Because your labels do not move me, do not determine what I am. My focus, my fight is not about political power. It's about those who understand that they have the right to be respected, standing for that right. At all cost and at all times. It was heartening to know that the minister, Todd, Minister of Foreign Affairs, in speaking for the government, made it clear that they, and I've seen it, and I alluded to this on my platform before, on my Facebook page, account. They pay attention to what is said. They allow free speech. I'm talking from me. They have no intention of having an issue with us having a conversation and with my speaking to my people. I hope that that is maintained because that's healthy for Guyana. We need an environment in which persons, and the minister said it, are able to tell the government, we don't agree with what you're doing. We don't accept this. We don't like this. And if it's rational, it's considered. That is maturity. And I don't have an issue complimenting people where it's necessary. But some up-north FC people have an issue with that now. You need to grow beyond having personal issues whereby you're closed to seeing good in anything. If someone does something that's good, they deserve compliment. If they do what's bad, they deserve to be criticized. If the PPP Civic is taking an approach that says that I am free to speak to people, it's healthy for Guyana. If we can meet as we have done in the Unity March, and we can speak in a public discussion, we can have it. Of course, we understand it is an infectious disease. You have to be careful at all times, and I'm health conscious. So I speak to these things. It's healthy. And any government is supposed to promote that among the citizenry. You can't lock people up because they can't talk. So I am not recruited as an agent of the government. I was met as one who stands for the people. And that shall remain my position. However, unlike a political party, I'm not just going to stand there and that's why I said what I said before about the Unity March. I am not going to stand there to launch attacks on individuals in the government so that people could be riled up and stuff like that. This is about a focus. We have an issue to deal with that has to be addressed. Persons are being made to feel, I'm made to feel, that vaccines are mandatory because of what surrounds it, consequences and money being spent that people don't have. And I will not lose focus on that and make this a PPP Civic matter and I'm joining somebody to fight the PPP Civic. It is not happening. Because I've said to you that there's no election in the air and there's no party to be voted out. And if the government is in and they're managing the taxpayers' money, they're making decisions, I cannot see an illegitimate government being able to issue an order that has people doing what they're told to do. Let's be rational here and let's get over and move on in the country. There is a time for political debates, for campaigning. There is a time for parties to be formed and parties to run to govern a country. But after that, there's a time for the country to be governed in a sensible way. This is the time for Guyana to be governed in a manner that makes Guyanese comfortable. This is not the time for us to dive into seeking to remove some party for 4 years. That's all you do? So the PPP Civic is incapable, as is APNOA C, or any other C in this country. You cannot drag me into any political circle to join you to fight anybody. It's not happening. And I will make it clear, a friend of my people is a friend of mine. If you want to fight my people, then we will have a problem. I said it about all y'all. If you treat the Guyanese right, because saints live in this country, people I represent live in this country, and if you treat Guyanese right, then we're okay. And I'm not talking about black, Indian, Chinese. I'm saying the Guyanese across the board. If you treat Guyanese right, I could deal with you. If you want to be an enemy of my people, I cannot be a friend. If you are unjust to my people, I will raise my voice against you because I'm mandated to speak against oppression. If you treat my people right, I shall compliment you. And at this forum, I compliment the Minister of Foreign Affairs for speaking to me. At least we had a conversation. At least he has taken note of the recommendations that people should not be paying for any PCR tests. People should be given a rapid test because it costs only $500 and it can be heavily covered by our taxpayers' dollars. Pensioners should, at this very second, should stop being made to pay for anything called a PCR test. It is crude and it is unjust to our pensioners. It shouldn't happen. GRA, NIS, the immigration office, and these places should not be shut away from our citizens. Build screens. Enclose the officers and let us have our lives lived. If you don't intend to force us to be vaccinated, then you'll make life easy for us. And we can therefore finally have a conversation on a national platform where our people can hear different minds speaking from a different place and they make decisions. You cannot mature society if you bind them to political garbage. They have to be exposed to different ideas, different opinions, because they see it on Facebook, they see it on the news, they see it all around, where there are debates being had. They see the Senate, they see Congress bombarding Fauci and people telling Fauci, you're a liar, you should go to jail. They see that in the US. We live in a real-time world. People can see Fauci having to sit and answer questions. People can see debates being had in other countries. What is wrong with Guyana? Why are we so weak that we cannot sit even as a minister with somebody in the community and have a debate? Let the Guyanese hear for themselves. But if you have a minister who says that everybody, every child, should be treated as though their parent is illiterate, then I would not expect you to have that kind of respect for us. I do not see this as the idea that spreads across the Pacific. It should never be. Guyanese are not uneducated people. We may not be highly qualified in tertiary education, but we're not uneducated. Give us the right to listen to debates, and I would like to submit that if Frank Anthony and his team are so convincing, then persons may be more than likely willing to be vaccinated. But if they're not convincing, then the government must respect the fact that persons have a right to make a decision. I thank you, and I hope, because I know, I say again, that when it comes to the Department of Public Information, they control what the public hears. They would edit what is said to suit that which the public needs to hear from their platform. I find it and found it necessary to speak to you from my place so you can understand that I have not been a sellout. I am not meeting with any political party to have a footing in them. I met as a concerned citizen who is deemed in the eyes of government and others someone who has got a leadership role that's being played. I'm grateful for those of you who understand where I stand. While the 12 to 16-year-olds are now on the table for vaccination, please join me tomorrow, probably in the morning or afternoon, because I will try my best upon recommendation of many people to speak to you as often as possible. Guyana is in a very tense situation right now, and we cannot afford to have a loss of focus. Nurses, because I need to speak to you, about what the FDA has recommended from Pfizer. You will hear it, I will read it. You would hear, and I hope you could have seen exactly what the Food and Drug Administration has said and mandated Pfizer to include on their vaccination vial containers. You would need to hear this. But apart from that, we can't afford to lose focus, because some of you are not seeing me on the street. Do not believe that I'm absent. Things are happening behind the scenes as today happened. I see the GPSU, the Guyana Public Service Union, has taken approach going to the court for relief. That is what happens. There are many ways to deal with these matters. So Guyanese, I ask of you, remain focused. Nurses, doctors, healthcare workers, teachers, public servants, private sector employees, remain focused. And remember that the first dose, according to their narrative, doesn't mean you're fully vaccinated. Because people died after the first dose. And they suggested at the Ministry of Health level that you're not fully vaccinated. So don't hop yourself around because you got the first dose thinking that you're now a god. There is still an issue for us to deal with. There's still research being done in this area. And we still need to pay attention to our health. I thank you. And I'm grateful for your patience and your focus. This is not a 2-day situation, but we must remain focused and we must remain resilient. The people rule Guyana. Be the movement. Regain your strength. Regain your focus. Do not be downtrodden because you're compelled to earn money. Regain your focus. Goodbye, and I'll see you soon. Yahweh willing. Bye.